Let's talk about mandibular plane angle or lower facial height visualized by finger or mirror handle. Steep angle mean long interior facial height and skeletal open bite. Okay, in open bite there is increased mandibular plane angle, and a flat angle indicate that short anterior facial height and deep bite male occlusion. Mini static tooth lip relationship. Okay, what is mini static? Mini static is tooth lip relationship. Dental midline, here we see dental midline, incisor stomion, and occlusal cant. Smile analysis, teeth and gum display, buccal corridor and smile. These things come smile arc. These things come under mini statics. Previously we had seen macroesthetics. Incisor stomion. What is incisor stomion? Is incisor display at rest. Excessive due to long lower third of face. When there is a longer face, there is excessive incisor stomion, mean incisor display. Short upper lip, there is shortness of upper lip too. Okay. Transverse cant. What is transverse cant? Transverse rotation of dentition at smile or at rest. It is known as transverse cant. Okay. Short or smile posed. Short smile or pose smile is focus of orthodignosis. Okay. Social smile or pose smile is the focus of orthodignosis. Display of 75% of incisor is minimum for excellent aesthetic. Okay, how much? Display of 75% of incisor is minimum for aesthetic for excellent aesthetic. Up to 4 mm lip coverage and 4 mm gingival display is acceptable. Okay, there with age there is decrease in incisor exposure. We had read it earlier. And what are buccal corridor or negative space? Is the distance between maxillary posterior and incisor of cheek. This is buccal corridor or negative space. What is smile arc? Smile arc is contour of incisor edges of maxillary anterior relative to the curvature of lower lip. Okay, it is smile arc. Contour of incisor edges of maxillary anterior relative to curvature of lower lip. Okay, broad smile is more static than narrow smile. Okay, broad smile is more static than narrow smile, and flattened smile arc or non-consonant is less attractive. Okay, what is that was about mini static. Now we will talk about microstatic. There were three types: macro, mini, and micro. Microstatic is about dental appearance, mean how much tooth height, gingival shape, contour, embrasure, shade. Okay, they come under microstatic. Width of the tooth should be about 80% of its height. Okay, width should be more than 80% of height should be more. Okay, width of the tooth should be or its scamming point. Width of tooth should be about 80% of its height. Golden proportion. This is an important thing to discuss. What is golden proportion? Width of lateral incisor should be 62% of central incisor. Canine width should be 62% of lateral incisor, and premolar width should be 62% of canine width. The posterior teeth should be 62% of the tooth anterior to it. Central incisor have highest gingival level. Okay, it is an FCPS part 1 dentistry MCQ 2. Maxillary central incisor canine have maxillary central incisor and canine have elliptical and lateral incisor have oval gingival shape. Okay, maxillary central incisor and canine have elliptical, while lateral incisor have oval gingival shape. So these are important points to remember for your any ortho induction exam. These points are for quick recall, for quick preparation, for superficial preparation. Okay, so if you find this point of beneficial, then you should subscribe this channel and like and share with your colleagues too. Okay, interdental contact area, which is under my microesthetics, move apically from central incisor to molar, is called connector. Most apical point on gingival tissue is known as gingival zenith. Most apical point on the gingival tissue is known as gingival zenith. It is an important MCQ too.